Medicine continues to change every day, and the doctors responsible for this are now doing what they can to share this information and news. Introducing Regenerative Medicine with Dr. Escobar, a new approach to pain management here in Florida. Dr. Escobar is board certified by the American Board of Anesthesiology, the American Board of Pain Medicine, and diplomat of the American Academy of Pain Management. He has been practicing in the area for over 15 years. He has lectured in the community as well as mass media on various topics in pain management. As a leading provider of interventional pain management in Aventura, Pembroke Pines, and Hollywood, Dr. Escobar works hard at treating the source of your pain with the goal of restoring you to full function in your normal life and activities. If you wish to join the conversation or have a question, please call 888-565-1470 and talk with Dr. Escobar. Now, here is Dr. Escobar and today's show.
Good evening, listeners. Thank you for tuning in. You're listening to the Regenerative Medicine Show. Got pain, avoid surgery with PRP, platelet-rich plasma, and stem cell therapy with Dr. Luis Escobar. We're back again this week to talk about your pain ailments and to see how Dr. Escobar can help you heal your pain, get rid of your pain, battle that pain, and get back to your lifestyle and living again. So, Dr. Escobar, thank you once again, for being with us today.
Good to be here. Thank you for having me again.
It's my pleasure. I'm glad that you're here. So, how have you been?
Very good, very good.
Good. Well, I always enjoy my time with you each week because it gives us an opportunity to learn a little bit more about this wonderful treatment that you do in your office, Pain Consults, Pain Care Specialists of Florida, which you have 3 offices located in Aventura, Hollywood, and Pembroke Pines. His office number is 954-322-8586, and it's a bilingual office. So you can contact his office and get consultation visits regarding whether or not you are a candidate for platelet-rich plasma and stem cell therapy. Now, I know, Dr. Escobar, many people have heard this terminology, stem cell therapy or PRP. What does that mean?
Well, what it is an enhancement of our own healing power, the body's own healing processes. And what we do is, if a patient has an injury that is not healing properly, we go and bring these cells from circulation with the platelets and from other areas such as the bone marrow or the adipose tissue where the stem cells live, and we bring those cells to the injury area of injury to promote the regeneration and the healing process.
So the PRP enhances the healing agents in your body in order to heal the injured site?
It is the normal healing process.
It's the normal healing
Correct.
process.
And when there's not enough healing, we multiply the number of cells by bringing them from other areas to the injured area to multiply the response and get the tissues to heal.
Well, that's incredible that you're able to do that. If you want to continue to listen to us, you can find us on 1470 AM. You can find us at iHeartRadio app at 1470 WNN or at wwnnradio.com. You can also tune in live and watch this interview now on Facebook. You can go to AMP number 2 TV Productions, and you can listen in. If you'd like to call in with any questions for Dr. Escobar, you can reach us at 888-565-1470. And as I said before, Dr. Luis Escobar has offices located in 3 locations here in South Florida, in Aventura, Hollywood, and Pembroke Pines, and his office number is 954-322-8586. So now, Dr. Escobar, what does PRP stand for?
PRP stands for platelet-rich plasma.
Platelet-rich plasma.
Correct.
And what is that? Where do we find these platelets in our body? How do we get them?
These cells are circulating in our bloodstream. Okay. Platelets are normal cells that are engaged in the healing process. If you have an injury, let's say bleeding, for instance, like a cut, the platelets will go through that area, through the circulation, concentrate in the area to try to stop the bleeding. Coagulation is the foremost function of these platelets.
And what does coagulation mean?
A process to stop the bleeding.
So coagulate means to stop bleeding?
To get the blood to clot, if you will, so stop bleeding, stop the bleeding. At the same time, there's a multitude of different chemicals that come into play to start immediately when the injury happens to start the healing process.
So if I sprain my ankle, fall down and bruise my shoulder or my wrist, and a bruise develops, does that mean that there's bleeding happening underneath the skin? Or are you referring to just when there's like a paper cut?
When you develop a bruise, I mean, that is all the inflammation that happens, all those cells that go to the area. That's the response from the body to start the regenerative process. It attracts the platelets. It attracts all the growth factors that come to the platelets. The platelets, if there's any bleeding,
is that why it gets swollen?
Correct.
So it doesn't get swollen because it's a bad thing. It gets swollen because that's the good parts of the body running to that area?
Exactly.
Interesting.
Swelling is a good thing.
Swelling's a good thing.
Too much swelling is a bad thing. So
too much swelling.
Correct. So, I mean, sometimes when the injuries are very intense, the swelling kind of like overwhelms the healing part. And then that's why when we process these cells to promote the healing, we take away the inflammatory parts of the cells and just bring the regenerative part of the cells, which include the platelets and the stem cells.
I see. So when people say they injure themselves and they say put ice on it, is that kind of in a sense taking away the inflammatory part of it? It's very superficial, I know. But people say ice and elevate.
That's the intent.
That's
correct.
the intent.
I mean, they try to take away some of the inflammation and a lot of the pain as well.
Sure.
So
that's the first stage of injury when someone first gets injured. At what point would you introduce the PRP or stem cell therapy in somebody's the course of their injury?
I mean, when you have an injury that is not healing properly on the normal amount of time, these treatments come into play. In some instances, even if the injuries are healing properly, but is something that you want to enhance and heal faster, this treatment come into play, and that will be what happens with the professional athletes. Professional athletes don't have the time to allow the normal healing process to take place, and you want to enhance the healing so they can come back to play faster.
So if a professional athlete gets injured in the baseball game last night, did you watch the game last night?
I did watch part of it.
You did? Yes. What do we got? The Cleveland Indians, and we have the Chicago Cubs?
Chicago Cubs, yes.
And so you rooting for anyone in particular?
I'm rooting for both.
You're rooting for both?
That's a pretty safe bet.
That's a very, very safe question. And so there's... If one of those players got injured sliding into one of the bases, or when they hit the ball, or when they went to catch the ball, the pitchers doing that repetitive motion. So today they're kind of in pain. They know they hurt themselves a little bit. How soon thereafter the injury can you introduce PRP?
Well, you have.
Is that something you wait a week? You wait 2 weeks, see if it goes away, or
we want to identify that there is an injury. These professional players, they're always sore after a game. I mean, there's a lot of trauma that takes place. But if something is rupture, if there's a tear in one of the muscles or the tendons or the ligaments, that's where these treatments will come into play to try to regenerate that faster.
Yes.
So the normal aches and pains, they will heal from that normally. So there's no need for these treatments. But when there's an injury per se, that's when this will be amenable.
And so you think that you could, sometimes when you're injured rather than just a sprain a little bit, you can sometimes tell the difference a little bit. Like I said, how soon do you think you could introduce it into the play? Is it something you should wait a few weeks, few months before I consult and contact your office? Or if I know I fell off the ladder this weekend trying to, cut off some palms off my palm tree, and I'm like, whoa, I think I kind of tore something in my rotator cuff, or I think I sprained my knee. Should I contact you right away?
Again, first of all, we have to determine whether there is an injury. And just being sore from a fall or a stretch it's not enough. But let's say that you have difficulty with certain motions, and then you suspect, when you just bruise or you
Sure.
tore something. So we have to make the diagnosis. If something is actually torn, like you just mentioned, the rotator cuff, the moment we discover that there is a tear, yes, that would be the right time to start the treatment.
That would be the
as
right
opposed
time.
to wait to see if it's going to heal or not. If it heals, great. If it's taking longer and it's not healing, then yes, the treatment would definitely come into play.
So if I'm injured, should I call my primary care physician? Should I make a visit with my orthopedic, or can I directly call your office? And are you able to handle that whole diagnostic realm?
You can call our office, and we will examine you and make sure that we determine whether it's something that requires more intensive studies, such as an MRI or an ultrasound, to determine whether there's a tear of any of the soft tissues, or even if you've had a fracture, for instance, you probably would have gone to the emergency room, because those, when you
Yes,
have
you
a
know when
broken
something's
bone.
broken.
Just to clarify, if you do have a broken bone, or you have an injury that needs emergency room
Call
treatment,
911.
you all go to your nearest emergency room and be treated. But once we dealing with an injury that needs to heal faster, we need to get you back to work sooner. That's when we will be able to help you with that.
Well, I like what I'm hearing, Dr. Escobar, because I like the way that you are methodical and the way that you want to assess your patients. You don't want to just you're not just trying to just bring somebody in just to give them, this treatment. You really want to make sure that the person's properly diagnosed. And that's number one, in patient care treatment, is knowing, what is the root of the problem, what's the severity of the problem, and, what's the best way to treat the problem. And I appreciate that, to hear, in a doctor that you're not in a rush to just treat, that you really want to find out what the root of the problem
We are
is.
in a rush to heal you once
You're in
we
a
have
rush
the
to
right
yes.
diagnosis.
Well, that's true. Yes, that's true. Rush to heal, but not a rush to not find out what the problem
Right.
is. That's very important. So we're going to go to break right now, and when we come back, I'd like to talk about a little bit more about Dr. Escobar's background, how he got involved in this, and just a little bit more about PRP and how it can help you in your ailments in your life. Thank you. We'll be back soon.
Get your life back from musculoskeletal injuries faster and without surgery. At Pain Care Specialist of Florida, Dr. Luis Escobar can help you do just that with regenerative treatments of platelet-rich plasma and stem cells. Stem cells live in all of us and act like the repairmen of the body. However, during injuries, we sometimes can't get enough of these critical repair cells to the injured area. This is where Dr. Luis Escobar may help you by harvesting your own stem cells and re-injecting them into the injured area in need of repair. To find out if you are a candidate for regenerative treatments with platelet-rich plasma or stem cells, please contact Dr. Luis Escobar at 954-322-8586 to make an appointment at one of his 3 conveniently located offices in Hollywood, Pembroke Pines, and Aventura. Or visit us on the web, www.painconsults.com. You are listening to Regenerative Medicine with Dr. Escobar. And if you wish to ask a question or participate in the show, call 888-565-1470 and speak to the doctor. Now, back to the show.
It's funny 'cause
Welcome back, everyone. Thank you so much. You're listening to the Regenerative Medicine Show. Got pain, avoid surgery with PRP, platelet-rich plasma, and stem cell therapy with Dr. Luis Escobar. He has 3 offices located in Aventura, Hollywood, and Pembroke Pines. His office number is 954-322-8586. His office is called Pain Care Specialist of Florida. He can be found at www.painconsults.com. And that's consults with an S, CONSULT, S.com. And he can be found at Facebook on Pain Care Specialist of Florida. You're listening to 1470 AM radio. You can also find us on the iHeart Radio app at 1470 WNN. And you can tune in live and watch us at AMP2, number 2, TV Productions on Facebook. So, Dr. Escobar, where did you go to school? Where did you get your background and your studies?
Well, I went to medical school in Guadalajara, Mexico.
Guadalajara, Mexico?
Yes, I did. Yes.
Oh, wow.
That was a last entry, as a matter of fact.
No, don't be
funny.
kind to yourself. Be kind to yourself.
And we did training in New York, anesthesiology at Brookdale Hospital University Center, part of the SUNY program of the State University of New York. And we did the anesthesiology, pain management, and that's what the practice was geared to mostly interventional pain management.
And so you have your specialties in anesthesiology.
Anesthesiology is the main practice.
Oh, that's exciting.
Yes.
That's wonderful.
And so we have been practicing interventional pain management, and we had this kind of like a frustration, if you will, that yes, we were treating pain, but we were not able to help with the recovery and the healing of the patients, other than sending them to do some rehabilitation on their own with physical therapy and the sort. So we started reading more and more about platelet-rich plasma, and we looked into it quite a bit, and it wasn't quite enough. And then we started getting into the stem cell treatments, and then this was enough. And combining both the stem cell treatments with the platelet-rich plasma, we have been able to help our patients regenerate their injuries and restore their quality of life much better than just by treating the pain.
So you're saying that PRP, that alone doesn't work as well as when you add the stem cell as well in combination?
Incorrect.
Now, is that two separate injections, or is that you how do you harvest the PRP, number one?
Yes, it is two different harvests, but it's one injection.
So then you mix those two together.
Correct.
How do you harvest the PRP?
The PRP, that's the simple one. We just draw some blood from the patient through special centrifuge. We separate the different cells. We discard the cells that we don't need, like the red cells and the white cells, and just keep the platelets that, as we described before, are involved in the coagulation and in the anti-inflammatory and the regeneration of tissues. Then we save those apart, and then we take some stem cells from the patient. And this can be harvested both from bone marrow, we use usually the pelvis, and or from adipose tissue. And again, once we have harvested the cells, we process it again through special centrifuges, different processes, separate the cells that we don't need, and come back with the stem cells, and we mix them together with the platelet-rich plasma that we harvested earlier. And then we inject that into the patient's injured site.
Now, is there a difference between what platelets are and plasma is? Or is that...
Yes, plasma...
Because when you draw the blood and then you end up with red blood cells...
Correct.
And white blood cells?
You draw the blood and you have the whole thing, which includes plasma, which is pretty much just some protein and fluid with a lot of other chemicals, but there's no cells. That's just fluid.
Just plasma,
Correct.
Okay.
And then you have the red cells, which is erythrocytes, which carry the oxygen, that's the main function. And we have the white cells, a multitude of different white cells, and these are more involved in a little bit of inflammatory responses, but their biggest job is to fight infection. And then you have the platelets, as we described before, are more involved into coagulation, clotting factors, and to regeneration and healing processes.
So you have the plasma, which is the protein, and then you have the platelets, which is helps with the coagulation,
Correct.
Which is the blood clotting. And so you separate. So the blood, when you spin it around in the centrifuge, it falls into four parts. Is that what I'm hearing?
Basically, you can see 3 different parts with the special centrifuge that we
Understood.
use.
I understood. And so then now you take that and then you harvest the stem cells as well. You said from the adipose tissue
Adipose tissue
and
or
or
from the
from the bone marrow.
Correct.
And so you said that's a little more complicated,
Well, it's not more complicated, but
more medically complicated a little
it
bit.
requires a little more training
Okay.
to harvest than just a simple drawing of the blood.
Is that painful?
Is a painful? It's not. I mean, we provide local anesthesia.
Okay.
So no, it might be a little bit of uncomfort while we injecting, but then the procedure itself is not really painful.
So then you take those two. You take the platelet, the rich plasma, and you take the stem cell. You can combine them together, and then you inject them directly into the pain site, which could be your back, your knee, your shoulder.
Directly into the injured area. The shoulder, the knee is very generic. Anybody can put an injection into the knee joint. When you're going to inject the injured area, what I'm referring to, you go exactly into the meniscus itself, is the meniscus where the injury is, or the ligaments, the lateral collateral ligaments or the medial collateral ligaments, or the ACL or the PCL, the anterior cruciate ligament and the posterior cruciate ligament. If they have some tears, we go exactly within the substance of those tissues to inject the cells. So this requires specialized training and specialized equipment. I mean, all these injections are done under fluoroscopy or ultrasonography, or both in some instances. Like the meniscus, for instance, is very difficult to access because it's within the major 2 bones of the knee.
Of the knee.
So we identified by both ultrasound and fluoroscopy.
And what is fluoroscopy? What is that?
Fluoroscopy is X-ray, is a real-time X-ray.
Okay.
It allows us to take a real-time visualization of the patient's bones on different positions. We can the machine moves in every different position, so we can always access the area where we're going to from different angles.
So it's similar to, I had the wonderful opportunity to observe Dr. Escobar perform some procedures in his office under fluoroscopy, and I noticed that you used different instruments to kind of identify the exact location of the site, so that you could visually see that precise place that you'd like to inject. And I was just blown away by that whole process of, and I think that, I guess what my point is that Dr. Escobar is an anesthesiologist, and he's gifted in the knowledge of the anatomy and physiology, and then gifted with the knowledge of medicine. And he's able to combine these two skill sets and perform now this other procedure, stem cell therapy and PRP therapy, and really help you try and eliminate your pain in your body. And you might be saying to yourself, why would I want PRP? Why would I want stem cell therapy? And it's because a lot of people out there may be contemplating surgery, Dr. Escobar. And how does surgery, when do you decide, should I do this or should I go to surgery? Can you talk a little bit about that?
Absolutely. If you have a significant injury and this is not healing properly, and you decided, okay, I need to go on the next step, and you went to your surgeon, and the surgeon says surgery, you owe it to yourself to perhaps try some stem cells with platelet-rich plasma to see if you will be able to avoid surgery, and very likely you will.
And very likely, wow. And so, at sometimes surgery is imminent. It has to be done depending on the injury, but we know that with surgery, you can be out of work for 4, 6, 8 weeks. So 4, 6, 12, 8 weeks, 2, 3 months. You lose time off of work, and you have to go through all the pain medication, risk for infection, rehabilitation. So stem cell therapy, how long does that take to do in your office? Or is that a hospitalization or an outpatient procedure?
No, this is an outpatient procedure. We do everything in the office. It's a same-day procedure. Let me clarify this juncture. The stem cells are autologous stem cells, meaning they are autologous, meaning they are from the same patient.
They're from yourself.
The cells come from your body, one area of your body, and go to another part of your body. So there's no donation of cells. There's no embryonic cells. Nothing controversial. It's all your own cells. Risk of rejection is negligible because unless there was something that contaminated the cells, it's your own cells. You shouldn't have to reject your own cells. So, and this is an outpatient procedure. It takes anywhere from 2 to 3 hours of an office visit from the harvesting to the injection of the area on a given day.
Well,
and you go back to your normal activities the next day.
See if it helps you.
We recommend you take it easy the day of the procedure.
I love each week that we come together, Dr. Escobar, and I think each week we kind of hit a little bit of a different type of subject to learn a little bit more about the body and how it responds to healing and how platelet-rich plasma and stem cell therapy could help you in your decision process of how to get yourself better. You are located in Aventura, Hollywood, and Pembroke Pines. Your office is called Pain Care Specialists of Florida. If you want to reach out to Dr. Escobar, he'd be happy to consult with you and listen to your questions and see if you're a candidate for PRP stem cell therapy. His office number is 954-322-8586. And again, you're listening to the Regenerative Medicine Show. Got pain, avoid surgery with PRP, platelet-rich plasma, and stem cell therapy with Dr. Luis Escobar. We'll be back next week. If you want to reach out to me, you can reach us at 888-565-1470. And you can also contact Dr. Luis Escobar at www.painconsults.com. Thank you again for listening, and we'll see you next week.
Thank you.
You have been listening to Regenerative Medicine with Dr. Escobar. Join us every week for more information and news on achieving full function in your normal life and normal activities. Call Dr. Escobar for more information at 954-322-8586. See you next week on Regenerative Medicine with Dr. Escobar. The opinions expressed on the preceding sponsored program were strictly those of its hosts, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors.